Hi, my name's Ginny Mills, and welcome to Parenting Through Addiction Towards Recovery. I'm your host for today's Parent Guide discussion. Our topic for today is Understanding Rehab, what works and what doesn't. I'm really here to introduce you to 6 key elements that make all the difference in the effectiveness of any treatment center. It's really important to remember that there are lots and lots of differences from treatment center to treatment center, from outpatient to inpatient to residential to wilderness to therapeutic boarding schools. Residential treatment programs are all very, very different. So let's get started with the 6 key points of understanding what works and what doesn't. First and foremost is your child's readiness to benefit from the experience. In some additional installments to Parenting Through Addiction Towards Recovery, you'll learn more about the stages of change. We recognize that people of all ages and all circumstances sort of go through a process of getting ready to make change and sustain change. So the first of those stages of change is called pre-contemplation. My favorite poster child for pre-contemplation is my grandmother. We used to look at her and say, "Mama Jen, don't you think it's time you quit smoking?" And she'd say, "Well, why would I do that? I like to smoke." She had no desire to make changes in her pattern of behavior. She saw no reason to, and she wasn't going to. So pre-contemplation is not the stage of change that we want to introduce a significant opportunity for treatment and recovery, because the person is not invested or ready to make meaningful change. The second stage of change is contemplation, getting ready, starting to consider it, preparation, actually moving in the direction of making change, and action is where we're really getting to. That's the goal, is to get to the action stage of change. And if your son or daughter has the opportunity to access treatment somewhere around preparation or action, then the likelihood of getting a good outcome is exponentially greater. If you offer that treatment resource when they are pre-contemplative or early in the contemplation process, the likelihood of getting a good outcome is just not all that high. Now, what are the things that create the opportunity for readiness to improve? I hate to tell you, it's pain. Pain creates distress. Distress creates motivation to do something different. Motivation to do something different creates readiness and receptivity to the benefits of treatment. And so when we make the opportunity for treatment available at the right time, opportunities for good success go up exponentially. So that's number 1. What's number 2? Number 2 is goodness of fit between the individual and the treatment resource. Remember earlier when I said that there are huge differences from treatment center to treatment center. So the way I want you to think about this is that treatment is a little bit like a school or a church or a Rotary Club. They may all use some of the same materials. They may all focus on some of the same subjects. Practically every college has an English composition course. Practically every church has a Bible of some sort that's a part of its operations and its delivery of services and its ministry. And so we know already that there are huge differences between Notre Dame and Warren Wilson, or Berkeley and Yale. There's just a huge amount of difference that comes into play when exploring treatment. We would never pick the closest college and say, well, I'll go there, without thinking about whether it is a place that offers what I want to study or whether it is a good fit for my needs. And treatment is the same way. Making sure that the treatment center that's chosen is a good fit for your son or daughter makes all the difference in the world. Some places have no walls. Some places are in the woods, some places are in the city, some places are inpatient, outpatient, with medication, without medication, with therapy, only 12-step, without 12-step. There's just so many variables that come into play. And you may very well need a professional to help you make that good fit between the needs, preferences, and resources of your family and the treatment resources that are available. So that's number 2, goodness of fit. Number 3 is that your son or daughter stays in treatment long enough. 2 weeks of residential treatment never got anybody to stay clean and sober. Detox never gets anybody to stay clean and sober. Short-term stays create the opportunity for stabilization. The longer that an individual is there, the more likelihood they can move from stabilization to actually making progress in learning and applying that learning to have new skills, knowledge, and abilities to apply those skills in real life to help get their recovery off to a good start. The longer time and opportunity they have to be able to learn and implement those strategies, the more success they're going to have. In general, I would recommend for someone whose use is uncomplicated, and by uncomplicated I mean probably a single drug like alcohol with no co-occurring disorders, 28-day minimum residential treatment, 90-day minimum intensive outpatient program if we're looking at traditional approaches to treatment. The more complicated it gets with co-occurring disorders like extreme anxiety, bipolar disorder, trauma, those kinds of complicating factors, or the addition of heroin, crack, meth, or anything IV as a part of the pattern of use, the more complicated treatment and recovery is going to be, because they're going to need longer to stabilize and more information to learn. So in a situation like that, 6 to 12 weeks is probably a better guesstimate of the length of time recommended for a residential program, more like 4 to 6 months for an intensive outpatient or traditional outpatient program, simply because recovery from this disease really is hard. And the more we give our sons and daughters the opportunity to apply what they're learning, the better their chances of long-term recovery. So number 3 is length of stay, making sure it's long enough. Number 4 is where you come in, family involvement. Most treatment programs have a family education or a family weekend or even a family week. I want to strongly encourage you to participate in that. That's your opportunity to be a part of the process, to learn the same information that your sons and daughters are learning, but recognizing how it applies to you. So participating in the family program, connecting yourself to support resources in your community, reading, learning, becoming an advocate for recovery, and demonstrating to your child that you are willing to put in some effort to do some work on yourself. Make no mistake, when you hear people talk about this is a family disease, that's for real. It's because as your son or daughter's use of substances progressed from experimentation to serious problems, you began to change as a parent. You began to change how you approach your child, how you approach discipline, how you approach monitoring and trying to control your child's behavior. And a really important part of your child's recovery is going to be them taking responsibility for their own recovery, which means you being able to back off. So how do you back off? How do you learn what you need to learn for your own recovery from your part of the family disease of addiction? So family involvement is number 4. Number 5 may be, it's hard to say, they're all so important, but number 5 is huge, and that's aftercare. Aftercare for at least a year after your son or daughter completes their residential or intensive outpatient program is going to be really key. So when I talk about aftercare, sometimes that means going to live in a sober living community or a recovery residence, or what we used to call a halfway house. Aftercare is the additional supports, the braces, the extra resources that wrap around your son or daughter after they leave the safe sanctuary that is treatment. Before I met my husband, he had a tragic accident. He was working as a painter on the outside of a building, and the scaffolding broke, and he fell 4 stories. He flipped twice, landed on his feet, broke both his legs and his back. He was in the hospital for about 30 days. Now, when he came out of the hospital, you can better believe he didn't come running out. He came out in a wheelchair with both legs in a cast and a brace around his middle. He needed the supports of those extra resources, the wheelchair, the cast, the brace, which later tapered down to crutches or a cane and less support. And eventually, after about a year or so, he really was able to run again, but not when he first left the hospital. And in the same way, when your son or daughter comes out of residential treatment or even an intensive outpatient program, they're going to need extra supports until they can run and function in their recovery independently. It just takes some time. And so aftercare for a year after treatment is absolutely essential if we're going to get the long-term outcome for recovery that you're looking for. Last but not least, so number 5, that was aftercare. Last but not least is that your son and your family need to find your tribe. So what's a tribe? It's your people. It's people who understand your experience. It's people who have had the opportunity to come to understand a little bit about addiction, a lot about recovery, and so that you feel supported and understood by people who get you. By people who get you. Finding your tribe so that you can have fun, have friends, have a life, not get high, and still not be alone is so important in early recovery. So your son or daughter needs to find a tribe. Sometimes that tribe can be through a 12-step community. Sometimes it could be through an enthusiastic sobriety community. Sometimes it could be through an informal group of other young people in recovery, or maybe even some of the chapters of young people in AA. I have with me my daughter's cup from when she went to the international chapter of Young People in AA, a national conference that brought people from all over the country and all over the world to Nashville, Tennessee last year. By attending conferences like ICIPA, or in our state, NICIPA, or in our region, PITIPA, having the opportunity to connect to other young people in recovery gives her a way of having fun, having friends, having a life, not using drugs or alcohol, but feeling understood by a community of people around her. Finding your tribe as a parent is also important, whether that's an Al-Anon, a local parent support group, our parent support group online, or Nar-Anon. There are lots of resources available to you. We want you to have a tribe so that you have people around you who understand your experiences as a parent, your experiences of tolerating the test of time, waiting for your son or daughter to be ready for recovery and ready for treatment and ready to start coming back to themselves. So those are our 6 items that make all the difference in what makes rehab work and what makes it not work. Because when any one of those 6 pieces is missing, your odds of long-term success go down. So let's review. Those 6 items are recognizing the readiness of your child for treatment and choosing to act when they are ready to begin preparing for action. Number 2, goodness of fit with the treatment program. We want to be sure that the treatment program chosen is a good fit for your son or daughter's needs, preferences, and your family's resources. Number 3 is that they stay long enough. Number 4 is family involvement. Number 5 is at least a year's worth of aftercare. And number 6 is that everyone finds their tribe. So my call for action for you today is to think back to item number 4, family involvement. By viewing this video, by exploring the opportunities that we will make available through Parenting Through Addiction Towards Recovery, you can access additional information. I want you to read. I want you to look out for parent support groups. I want you to begin thinking about what your new normal could look like as a parent, advocating not just for your child's addiction recovery, but also for more resources in your community, in your state, in your region, in your country, for people to have the opportunity to move from addiction to recovery with lots of help, support, compassion, and resources. I'm Ginny Mills. Thank you for joining us. I hope you will continue to stay involved with Parenting Through Addiction Towards Recovery.